From Washington, D.C., this is the Muslim News on Muslim Network TV. Assalamu alaikum, I'm Hena Zuberi. Our top story tonight is about the Afghanistan situation. The United States, Canada, and Britain have ordered the deployment of thousands of troops in Afghanistan to evacuate their nationals. The American embassy urged Americans on Thursday to leave Afghanistan immediately using available commercial flight options. The U.S. embassy in Afghanistan told staff to destroy sensitive material. The order came as the Taliban overran the country's second largest city, Kandahar, and the third largest city, Herat. This leaves the Afghanistan capital, Kabul, vulnerable to a Taliban takeover. The New York Times is reporting that American negotiators are trying to extract assurances from the Taliban that they will not attack the U.S. embassy. Kandahar is completely conquered. The Mujahideen have reached Martyr Square, a Taliban spokesman tweeted, referring to a city landmark. Solo News from Kabul is reporting that the Taliban have so far captured at least 17 provincial capitals. U.S. Republican Minority Leader Senator Mitch McConnell compared it to America's humiliating withdrawal from the Vietnam conflict in 1975. Politico is reporting that aviation tracking data suggests U.S. Air Force B-52 bombers, F-15 fighter jets, drones, and other aircrafts were involved in fighting overnight across Afghanistan. The Taliban, in the meantime, has been flexing its governing muscle. They announced that they will be providing security to Shia processions during the Islamic month of Muharram. In the past, the group has reportedly attacked members of Afghanistan's Shia Hazara minority. The Taliban has announced that operating airports in the country are under their control. The group's spokesperson, Zabihullah Mujahid, tweeted that the first flight took off under the control of the Islamic Emirate. It was flown by a United Nations plane to the Badakhshan province yesterday. Included in the military equipment captured by the Taliban are the helicopters given by India. The Taliban has reopened the Chaman Spin Buldak crossing with Pakistan. They had shut it down when Pakistan insisted on visa requirements for entry. The Taliban were demanding that Pakistan allow Afghans to cross the border without a visa using an Afghan ID card or a Pakistani-issued refugee registration card instead of a visa. Afghanistan has faced the Soviet Union and the United States invasion, as well as its own civil wars. Each time, it is the civilians who suffer. More details in this report by Ali Khalaf and Saleha Farouk.
The UN says 30,000 Afghans are leaving the country every week. They will join millions of Afghan refugees around the world. About 3 million have been living in Pakistan for 40 years. This video shows thousands of Afghans crossing the border to Pakistan. But then there are millions who are forced out of their homes within Afghanistan. The United Nations has a fancy term for them. They are called internally displaced people. They are sitting under the trees in Kabul. Some lost their loved ones in aerial bombings. Others flee because of fear, yet others will simply go hungry. The UN warns Afghanistan's conflict is taking the heaviest toll on displaced women and children. Women and children. In each war, they are the ones who suffer the most. May God protect them. May God help people to be merciful to each other.
The population of the United States grew from roughly 308.7 million in 2010 to 331.4 million. That's an increase of 7.35%. But this is also the slowest growth rate since the decade between 1930 and 1940. The country's multiracial population has increased by 276% since the 2010 census. It grew from 9 million in 2010 to 33.8 million in 2020. The 2020 census puts residents who said they identified with two or more racial categories into an independent group. Whites make up 57.8% of the population, or over 190 million people. California, Hawaii, and New Mexico, as well as the District of Columbia and Puerto Rico, are the only 5 areas where non-Hispanic white Americans are a minority. Hispanics or Latinos make up 18.7% of the US population. Blacks or Africans are at 12.1%, or over 39 million people. But the Census Bureau is puzzled about why 10 to 20% of the questions were not answered in the 2020 census. Unanswered questions used to make up only 1 to 3% of the census in the 170 years of census taking. This early report by the Census Bureau reflects an early stage in the number crunching. This, however, has not stopped the rush to use the data for redistricting and gerrymandering. Boundaries of congressional and legislative districts will be redrawn as a result of the final numbers. Florida is leading the nation in COVID cases. The US now has an average of 125,000 new cases a day and more than 600 deaths daily. 8 states which lag in vaccinations make up 51% of all hospitalizations. They are Alabama, Arkansas, Florida, Georgia, Louisiana, Mississippi, Nevada, and Texas, according to CNN. In the meantime, the Food and Drug Administration has authorized a 3rd dose of the vaccine with people with weakened immune systems. While America's right-wing wages war on teaching critical race theory in schools, some Christian private schools are writing a different history. An analysis by the UK-based newspaper, The Guardian, reveals that thousands of private Christian schools in the US have been whitewashing history for years. Textbooks in these schools minimize the legacy of slavery. Some even call it Black immigration. Some textbooks in these schools also frame Native Americans as inferior. Many of these schools receive tens of thousands of dollars in public funding every year. A New Jersey school board member who posted inflammatory messages about 2 Muslim congresswomen has resigned. Daniel Leonard is a Toms River Board of Education member. He came under fire for posting a photo of Representative Ilhan Omar with the caption, "Terrorist 100%. He also wrote, quote, "My life would be complete if she/they die," above a photo of Representative Rashida Tlaib on his personal Facebook page. Leonard has also decided not to run for re-election in November. In a statement, National Civil Rights Organization Muslim Advocates said Leonard's resignation is a welcome victory in their fight against hate and anti-Muslim bigotry. The Texas State Senate has passed a controversial election bill. If it becomes law, the bill would add new restrictions and criminal penalties to the voting process. But it's unlikely to become legislation, as the Texas House failed to have a quorum. It was due to the fact that the state Democrats decided to stay out of Texas as a way to avoid voting on it. Nevertheless, State Senator Carol Alvarado wanted to make a statement through her filibuster. She spoke on the bill for 15 hours and 4 minutes. She remained on her feet the entire time, not sitting, leaning, eating, drinking, or using the restroom. Unlike in the US Senate, Texas Senate filibuster rules allow any member to threaten a filibuster. Alvarado wore a back brace and used a catheter for support. Phineas Park, Florida police have arrested a youth director of a local mosque for engaging in unlawful sexual acts with minors. In March, police said that they began their investigation into a 51-year-old Ihab Mustafa Ghonem. This was after learning that illegal acts were taking place at his Phineas Park home. They said he met his victims when he volunteered as the mosque's youth director. Officials did not name the mosque. Ghonem was arrested in Chicago as he returned to the US from Egypt. He faces 3 charges of unlawful sexual activity with minors. Detectives said that he has ties to a New Jersey mosque as well. They're asking anyone with information to call the Pinellas Park Police Department. Twitter and Google intend to remove content that denies the 1995 genocide in Srebrenica from their platforms, according to a report by Radio Free Europe. The systematic murder of more than 8,000 Bosnian Muslims in Srebrenica by Serb forces in July 1995 was ruled as an act of genocide by the International Criminal Tribunal for former Yugoslavia and the International Court of Justice. Twitter and YouTube were responding to a request by the Institute for Research of Genocide, a Canada-based organization, on their established policy that sanctions all hate speech. Pakistan's Foreign Minister Shah Mahmood Qureshi says Pakistan will do everything possible to punish those responsible for an explosion on a bus that killed 9 Chinese nationals on July 14th. He claims that the Indian intelligence service and Afghan agencies used the Pakistani Taliban to carry out the suicide bombing. China has sent investigators to Pakistan to probe the explosion that killed 12 people, including 9 Chinese nationals, calling the blast a terrorist attack. Islamabad is Beijing's closest regional ally, but the security of Chinese workers in Pakistan has long been of concern. The abuse of Indian Muslims continues. A 45-year-old Muslim man in the Uttar Pradesh town of Kanpur was paraded through the streets, assaulted, and made to chant Jai Shri Ram slogans on Wednesday. Distressing footage of the incident shot by locals showed that the man's little daughter clinging to him and begging the attackers to spare him. The footage also shows the man being hit while in police custody. The incident took place close to an intersection where the right-wing group Bajrang Dal held a meeting. In that gathering, they claimed Muslims in the area were trying to convert a Hindu girl in their locality. The assault reportedly took place right after the meeting. Coming up next after the break is our in-depth analysis segment. So stay tuned and we'll be right back after these messages.
If I could be you, and you could be me for just 1 hour. If we could find a way to get inside each other's minds. Walk a mile in my shoes. Walk a mile in my shoes. Well, before you abuse, criticize, and accuse. Walk a mile in my shoes.
Despite the development of a COVID-19 vaccine, millions around the world will not have access. We need a vaccine that's free and available to everyone, everywhere. It's time for a people's vaccine.
A child younger than 5 has died of COVID-19 at a Tallahassee hospital this past month, the first child to die there of the disease, the hospital confirmed Thursday. As of Friday, 8 children younger than 16 have died with COVID-19 in Florida, where 289,000 have tested positive. Officials are calling the Delta variant a different beast. Unlike in previous waves, where the majority of pediatric hospitalizations with COVID-19 were incidental findings, the majority now are headed to the hospital specifically for symptoms related to the disease. Children under the age of 12 are not eligible for vaccines at this time. So how do we keep children safe from this different beast? To discuss this, we have with us Dr. Uzma Sayed, a COVID expert and infectious disease specialist. Welcome, Dr. Sayed.
Thank you so much for having me.
So how do we keep children safe as schools are opening up and parents and teachers are worried?
That's an excellent question. And I think the safety and health of our children and our communities should be the utmost priority. As you've mentioned before, Delta is a whole new beast. And I think with every new emerging variant that we have with SARS-CoV-2, we've seen that it becomes more and more complicated because these variants are becoming more and more transmissible. So what that means is that it's very easy for a person to be affected and in fact get infected from someone who is actively infected with this virus. You need very little amount of time for someone to be exposed. And we know that children right now under the age of 12 are not eligible for vaccinations. So what we can do is really protect them by getting all the people that are around them vaccinated so that we can really bring the level of virus down in our communities at a time where the virus is surging throughout our country and throughout the world. We really have to do better to protect all the children.
What are some common sense precautions that schools should be taking, especially private schools?
That's a great question. We've seen in the past year how schools really have not been the main place where virus has been spreading rapidly because of all the mitigation strategies that have put into place. Now that we have vaccinations, in addition to that, we really can open the schools up in a safe way if we continue to make sure that all faculty, staff, administrators are vaccinated. All children above the age of 12 are vaccinated, and we continue to use all of those protective measures, the layers of mitigation strategies that we have that we know work. Masks are very good at preventing spread of virus. Distancing, ventilation is key. So all of these things have been proven to be effective, and we have to ensure that we use the multiple different approaches to really have that layered approach so that we are having a safe environment for our children.
So what if you live in a state with a school mask mandate ban? More than 800 physicians in Florida have signed a letter to Governor DeSantis asking him to repeal his school mask mandate ban. So what would be your advice to parents in those states?
Unfortunately, this pandemic has really been very much a political one, and we have to separate the science from the politics. We're talking about the health and the well-being and the lives and livelihoods of children and adults. And we know scientifically, we know what works. We know that the vaccines work. We know that masks work. And until we can get really the virus level really low in our communities, we have to do the precautions, the right precautions that we know work to keep the number of people safe in our communities. So for parents and for children alike, I would say really try to get vaccinated and get the kids around you vaccinated. Masks really do work, and I would encourage people to use their voices to really make sure that our children are safe, in our communities and in our schools, to really voice your concerns about how important these masks are, at least until the level of virus is very low in the communities. In Florida, unfortunately, they have significant surges. We have seen the pediatric cases go up significantly week after week. We're averaging about 200 kids being hospitalized a day, and we have to protect everybody, especially the children who may be most vulnerable now.
You're talking about effective measures. Are temperature checks effective?
Unfortunately, temperature checks are not really effective, as we would have hoped they would have been. What we're seeing, especially, there's a wide spectrum of disease that people can have. Some people, as you know, can be asymptomatic. Some people can have mild symptoms. So what that means is that they may not have a temperature at all. So that's not going to be the only thing that's going to help you really detect this. At this point in the pandemic, when we have readily available vaccines, this has become a vaccine preventable illness. And so we really have to focus on that. But a good screening questionnaire would be good. It's really an honor system at this point. So we really have to have these conversations with parents to urge them to get vaccinated to protect their children, their loved ones, whether they have elderly people in their family, in their households. And it's really about community. And it's really about doing good for the greater good of the community, for our states, for our country, for our world.
So let's talk a little bit about mental health. It's hard to explain to young children why they need to wear a mask, why they can't hug their friends. So how do we make sure that children follow SOPs?
I think that's a really important message. We've seen, unfortunately, children have suffered so much in this pandemic. With the schools being shut down over the past year, our children have really been impacted by this, and it's really had a tremendous strain on their mental health. We can see just how much they've been affected. And, we've been having these difficult conversations with children, but, we have to remember that children are really resilient. And for the most part, children have done really well with wearing masks in the past year in schools. They've done better than most adults adults have. And so, we just have to have these open conversations with them and explain to them what is the mask actually doing. It's protecting them, it's protecting their loved ones. And until, they can get vaccinated, this is how we can ensure that they will be safe and they can still have that social interaction. There's lots of activities that are safe. Outdoors is safer than indoors. And so we can promote them having that social interaction that is needed, as well as getting them back to school, which is so essential for them for their physical, mental, and emotional well-being.
Now, this is a question from an audience member. Can you give us some examples of effective approaches to lunch amongst the 11 and under set?
That's a great question. And I think, if there's a thing that's worked, we've seen in the past that, a staggered approach to lunchtime and meals is very effective. So, anytime you have crowding and large crowds gathering and indoor spacing, that's where you can have a difficult scenario. So ventilation is key, as I mentioned before. So if schools can really promote adequate ventilation, that's another safety measure. Keeping the household itself safe. So if you have, the children really are exposed from adults. So if we can keep the adults at home healthy and safe, that's less exposure for the children. Same thing goes for faculty members and administrators and teachers. If they're vaccinated and healthy, then that's less exposure for the kids as well. And then once you have children that are, eating, you can essentially try to stagger the meal time as best as possible, have the spacing and have adequate ventilation. And that can really be, a safer environment to be in.
So before we let you go, can you reiterate what is this Delta variant and how is it affecting the population?
So the Delta variant, is a new variant for this coronavirus, and we have seen that it's been proven to be much more transmissible. If you look at the original virus that we have, one infected person could, in fact, infect between 2 and 3 people. Then we had the Alpha variant, which was more infectious than the original variant. The Alpha was the B.1.1.7 variant, and we saw that number went up from 2 to 3 to about 4 to 5. Now we have the Delta variant, which is even more infectious than the Alpha variant. And, this number from one infected person, you could infect up to 8 people. So, they've been proven to have, these people that are infected with Delta have 1,000 times more viral particles, meaning that they're so much more infectious, meaning that you really need a small amount of time of exposure to get infected. So it really, has changed the landscape. And you can see with the number of cases across the country, the surge in cases throughout our nation and throughout the globes, how much more problematic this is. And, with vaccines, this is something that we can really help control before the virus keeps circulating, where we have more and more emerging variants that at some point may escape these current vaccines. Right now, the vaccines that we have that are approved by the FDA are all effective against our variants, including the Delta variant. So that's really the strongest tool that we have in our toolbox right now. But, I urge everyone to really continue to take precautions, get vaccinated. And while there's so much virus in your communities, still continue to wear your mask when you're in crowded indoor settings, especially if you're going to be around people that you don't know their vaccination status, you don't know if they're healthy or if they're sick. And if you take these right precautions, then, we will get ahead of this at some point.
Thank you so much for your insight. I just wanted to ask you one more question. With flu season coming up, what would be your advice to parents if kids are showing symptoms? We've heard of cases where parents have let kids go to school while they have fever.
I think for any respiratory illness, I think it's really important that we really hone in on these principles, that we keep children home when they're not feeling well. We've dealt with influenza year in, year out, and, now we're dealing with, COVID-19, which is a whole other beast, as you mentioned before. But we have to really focus on how contagious this is and how dangerous it can be for somebody to be infected and then attend school. So any symptoms that children might be exhibiting, it's really important that they stay home until they're feeling better, that they get evaluated by a medical professional, and they not return to school until they're really feeling better and their symptoms have resolved. We have seen that, with the mask mandates that were here last last year, our flu numbers were practically non-existent. So we know that these measures really work. And we know that masks help with COVID-19 as well. So we just want to ensure that people are taking the right precautions. It is going to be an honor system, but we really have to think about the people that you are going to be exposed to, that your child might be exposing as well. And we really want to make sure that we are continuing to practice safety for everyone.
Thank you, Dr. Syed, for your insight and expertise. Stay safe.
Most welcome.
And for you, as with any infectious disease, take precautions. If your child has measles, you would not send them to school. So we need to treat COVID-19, especially this Delta variant, like measles or chickenpox. Before moving on to our next analysis, let's take a quick break, and we'll be right back after these messages.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
They took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad! You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
Welcome back. In one of our previous in-depth analysis segments, we discussed the shortage of Muslim chaplains to minister Muslim inmates in the U.S. prisons. Let's watch this segment again.
Thank you, Hena. There are more than 11,000 Muslims in federal prison system, but there are only 13 chaplains or Islamic scholars to minister to them. There are different forms of discrimination takes place, but these people are incarcerated. They need spiritual help along with many other things. Why there are so few? And who is issuing these numbers, and what can be done to change it? We have someone who is engaged with this process. He is a program manager and a teacher at Taiba Foundation in California. Abdul Muhaymin As-Salim. Assalamu alaikum.
Alaikum assalam wa rahmatullahi ta'ala wa barakatuh. How are you this afternoon?
Alhamdulillah. Welcome to Muslim Network TV. Why there are so few Muslim chaplains?
Well, one of the larger challenges I learned in being engaged with the BOP prison system and how they go about hiring chaplains is that they often, or they're not often, they do have a stricture of having chaplains who are master's degree level training. Whether or not they actually are qualified in terms of having studied the Islamic sciences in a traditional manner or through a university system and are able to relate and teach the Islamic sciences on that level, having the master's degree is a big challenge. And one of the things that we've noticed over the years is that a lot of the people who are qualified to actually be chaplains or go in and service to brothers and sisters in prison, they don't have master's degrees. So that adds an element of hindrance to being able to be hired for these positions.
That's very surprising because according to most surveys, Muslims have the second best educational background, in the nation, better than average population. So why is so difficult to find people? Is this the case that there are Muslims who don't want to serve as chaplains?
I wouldn't say that they don't want to serve as chaplains, but the problem being is like most people who go off and study in traditional manner, once they've done all of the studies that they've done and reached the levels that they reach and come back, most of them have gone through what can be considered a master's level program, but they haven't gone through a university system to have attained that a lot of times. So having the actual accredited university saying that, yes, you have a master's level training in such and such a field, chaplaincy or Islamic studies, the individuals, they usually don't have that. Most of them have traditional ijazas. Some of them have bachelor's degrees, but just having the master's degree in terms of Islamic studies or chaplaincy has been a problem. Over the years, there have been a number of people who have been trying to remedy that. Quite a few people that I'm aware of that have gone to gain their masters in chaplaincy and other different types of religious learning within that realm right there, whether it's chaplaincy, divinity, Islamic studies, things of that nature. There, it's still a lack of people having or wanting to pursue that particular route of master's level study.
So there are people who are learned, but they are learned in a different system, and there is no accreditation program that, okay, this particular degree in Islamic, training equals to master's degree. So equivalency establishment is an issue then. Is that correct?
Yes, that's one of the issues. Absolutely.
Okay. So what do you think? Is that the only reason, or there is some form of discrimination against Muslim because Islamophobia is out there and Muslim left and right are discriminated? Is there some discrimination in this, or it is essentially a technical issue of a process of accreditation?
You could say that there may be some discrimination. I won't just give a blanket statement and say that, yes, it's pure discrimination going on. Oftentimes, a lot of the chaplains that we do communicate with, they would love to have Muslims come in and provide services to their inmate population. As with the inmates that we work with, chaplains contact us all the time, wanting us to be able to send information in about our program so that brothers and sisters can utilize it. It's just really more or less a matter of Muslims actually understanding and making a more concerted effort to go and pursue these particular types of careers and helping brothers and sisters that are incarcerated. Some may think that there may not be enough money in it. It could be a number of other reasons on an individual level, but as a whole, it's really more or less, as a community, we need to be more focused on actually providing these types of services and having people who are trained and capable of going in and providing these types of services. And one thing I often proffer is that not necessarily should the chaplain need to have a master's degree, because you have a lot of very qualified people who can go in and provide these services. And they don't have masters. We look at a lot of imams and other individuals across the country who've been providing services and working with individuals in the community or in other settings, and they've been doing a tremendous job, and they don't have master's degrees.
Why there are so many Muslims in the prison system, Brother Abdul Muhaimin?
Well, the primary thing is conversion. A lot of the brothers and sisters who are in prison right now who are Muslim, they converted while in prison. I converted when I was on my way to prison, going to federal prison 17 years ago next month. So it's really a matter of conversion. A lot less of the number comes from people who were actually born Muslim or raised as Muslims on the street and got into some kind of trouble and went to prison. That's a much lower numbers, probably maybe 1 or 2% of that 11,000.
Alhamdulillah, because this is my observation. I mean, wherever Muslims move in and mosque is established, crime goes down. I mean, in Philadelphia, in the inner city, when Imam Gamble's area, I mean, it's amazingly clean area. I'm in South Side. Wherever a mosque is, the property value goes up, crime goes down. And that's why I was wondering. So you're saying that these are the people who accepted Islam while they are in the system. Now, when they come out of the system, I mean, you are among those people who came off the system and became Muslim. Are there enough facilities available for them to be rehabilitated in the society?
Currently, there aren't. There are a lot of programs that are out there that brothers and sisters take advantage of when they come home, but either they have a secular, totally secular base, or either they're based on a lot of Christian models. So there are not a lot of programs for Muslims that are run by Muslims to be able to come out and engage with reentry skills and training and coaching that helps them follow along the path of the teachings of Al-Islam. Tabor Foundation is one. There are one or two other programs that are coming up that may have a blend. Tabor Foundation is a little bit more focused on the Islamic studies, and then we transition the students. The Islamic studies program is open to everyone, but primarily we have Muslims. We have the life skills open to everyone, but primarily our students are in there that are already Muslim. And then we also have the reentry services that we provide. And the same thing again, it's open to everyone, but primarily our students are in there and they're Muslim. So the opportunity to build out with some more programs is definitely needed across the country, because everywhere that you go, most major cities and even smaller ones and mid-sized ones, Muslims are coming home to these areas, and they need to have some type of service from the community that's available to help them and make them feel welcome.
Abdul Muhaymin, on your interview with NPR, I saw you have very precise number of 11,000. This are Muslim prisoners and only 13 chaplains available to serve them. How did you get these statistics?
Those numbers, as I'm aware of, they came from the study that was done by the Department of Justice and the Bureau of Prisons for their particular inmate population. I think the Bureau of Prisons has around 130, 140 some odd thousand inmates that are incarcerated under their system. And of that number, they said 11,000 some change were Muslim. From experience, that number could be a lot higher. Oftentimes we see these numbers, they're very conservative estimates that are being made, because oftentimes you'll have brothers and sisters who convert, but they don't, when they come in, they may have been Christian or atheist or whatever, but after their conversion, they don't usually go back and give the new religious designation. And then you'll have people who go to religious services or who are not signed up to go to religious services. And then oftentimes the numbers can be a little bit less than what they actually are. But those numbers in particular, they should have come from the Department of Justice and the Bureau of Prisons. Those weren't Tabor Foundation numbers.
Now, I visited Tabor Foundation website where you work. It says that help thousands of Muslims that are unjustly incarcerated. I paid attention to why they are unjustly incarcerated. So do you encounter people who you feel are unjustly incarcerated, or it is just a fundraising thing which you have put it up?
No, we have several students who have cases that have been recognized as being unjust incarcerations. We have one brother named Ahmed Adisa. He's in Missouri. He was convicted of murder. The person who testified against him later was arrested for some other crime, and he retracted his statement and let them know that he had lied. There was a documentary done on Ahmed in his case, and is a process of trying to get him back into court to have this situation addressed and corrected. There's also another brother we have by the name of Kevin Tolliver in Ohio, and he has a case of murder that was looked at to be wrongly adjudicated, and he's been having issues with getting back in to have his case looked at again and redressed. There's a number of people across the country, we see this stuff all the time. again, like with myself, I was guilty. You know, I wasn't guilty of exactly what they accused me of doing, but I was guilty. I used to break the law. And that was just the reality of it. A lot of people who are in prison are there because they did something wrong. And it's not a matter of trying to make things seem as if they were unfair. It's just we corrected ourselves after we got into the situation that we were in. We became Muslim, alhamdulillah, and we worked on correcting our past wrongs and living a life that was exemplary of what Islam stands for and what Prophet Muhammad sallallahu alaihi wasallam taught and expected of us. So it works both ways.
Okay. Brother Abdul Muhaymin, one of the names which I saw on your Taiba Foundation's website is Yusuf, that he was denied parole until your organization helped him hire a lawyer for the process, after which he was swiftly released. He now runs a not-for-profit which employs 70 people. So that seems to be an amazing success story there. What was his problem? Why he needed your help to get out?
Brother Yusuf Wali, as his name is, Andre Yusuf Wali, he's from California. He was a gang member. He was convicted of a murder. And after having spent, I believe it was 23 years at the time he was released, he had just been getting a lot of parole set-offs. He started programs. The program that he's actually running now, the original model of that was something that he started while he was in prison, and he had made tremendous efforts in working with the administration and with the population of the prison to have programs, peer-based programming that was working and it was helping people. And it was just the fact that the parole board just didn't want to give him his opportunity to go home. And again, like you said, Taiba Foundation helped him retain a lawyer. The lawyer was able to get him another parole hearing, and he was subsequently released as a result of that. And here we are. I believe he was released in 2012. 9 years later, he's running $1 million organization employing people in the Los Angeles County. He also has an office in the Bay Area, but he's been doing tremendous work with the city of Los Angeles.
Thank you so much, Brother Abdul Muhaymin, for your time. Truly appreciate that.
Alhamdulillah, I'm glad you had us here. Alaikum salam wa rahmatullahi wa barakatuh.
Back to you, Hena.
That's all from our Washington studios tonight. Thank you for tuning in. You can find previous episodes and more on our YouTube and Facebook. For more content, keep watching Muslim Network TV and visit muslimnetwork.tv. Assalamu alaikum and good night.